بسم الله الرحمن الرحيم. أطباؤنا الأعزاء، ضيوفنا الكرام، السلام عليكم ورحمة الله وبركاته. أسعدتم مساء وأهلا ومرحبا بكم في حفلنا اليوم. لقد تشرفنا بهذا الحضور الكريم. إنه لمن دواعي سرورنا أن نحظى بفرصة فريدة تجتمع بها هذه الكوكبة المميزة ممن انكبوا دوما على رسم ملامح الطب التجميلي في منطقتنا. وإنه لمن واجبنا كالشركة الرائدة إقليميا في قطاع الطب التجميلي أن نقدم لمواهبكم أفضل الأدوات التي من شأنها أن تكمل إبداعكم التجميلي. اليوم هو يوم إيفوار، الفيلر الذي وجد ليتربع على العرش التجميلي والذي يضاهي بجودته ونتائجه كل من دونه. وهنا يشرفني أن أدعو إلى المنصة السيد تامر والي، الرئيس التنفيذي لشركة إمداد، ليلقي كلمته الافتتاحية، فليتفضل مشكورا.
الأطباء الموقرون، الحضور الكريم، السلام عليكم ورحمة الله وبركاته. يسرني للغاية رؤيتكم والترحيب بكم ضمن فعاليات إطلاق إيفوار هذه الليلة، وأشكركم على أخذ البعض من وقتكم في عطلة نهاية الأسبوع لمشاركتنا أمسيتنا. فإذا وبعد 30 عاما من توفير الأجهزة الطبية التجميلية في الشرق الأوسط، أخيرا إمداد تطرح فيلر. فما الذي أخذنا كل هذا الوقت؟ نحن نعلم بأن الفيلر بالنسبة لكم هو أمر شخصي، اختيار خاص، حيث يعرض الفيلر إبداعاتكم الجمالية ويطبع بصمتكم الفنية. كما أننا نعلم بأنكم لا تبحثون ولا تحتاجون إلى مجرد فيلر آخر. لذلك عندما قررنا البحث في الخوض في هذا المجال، فإننا قررنا أنه حصراً في حال استطعنا أن نعثر على فيلر يقدم قيمة إضافية مهمة بالنسبة لكم ولعملائكم، في حينها فقط يجدي بنا مد قيمتنا المضافة إلى هذا المجال، وإلا فلا داعي لذلك. لن نقوم بإضافة مجرد فيلر آخر إلى باقة منتجاتنا التي انتقيناها بكل عناية على مدى هذه السنين لتكون هي الأفضل والتي بتم تتوقعونها من شركة إمداد. ومن هذا المنطلق دأبنا في البحث عن هذا الفيلر الذي جدير به أن يحظى باهتمامكم وثقتكم. وبعد عدة سنوات من البحث وجدنا ما كنا نصبو إليه: شركة مصنعة بعلامة تجارية معروفة عالمياً وذات سمعة مرموقة. فيلر يتم تصميمه وتصنيعه بالكامل داخل نفس الشركة، بدءاً من المواد الخام إلى المنتج النهائي بما فيها السرنج. هايلورونيك أسيد ذات ملكية خاصة، مصمم بخصائص فيزيائية فريدة، خصائص فيزيائية تقدم صفات وقدرات سريرية مميزة، تدفق سلس، كثافة أعلى، قدرة أعلى على الرفع، ورم أقل، وأقل ردة فعل من الجسم. فيلر يزيد من قدراتكم ونتائجكم وسلامة ورضا عملائكم. نحن فخورون اليوم بطرح ليس مجرد فيلر آخر ولا مجرد فيلر ممتاز آخر، نحن فخورون بطرح إيفوار، فئة جديدة من الفيلر يرقى بإمكاناتكم وإعجاب عملائكم. شكرا لكم مجددا مشاركتنا، وأرجو أن تستمتعوا في هذه الأمسية.
شكرا سيد تامر والي على هذه الكلمة. والآن نشاهد سويا فيديو تعريفي عن شركة LG، ويليه كلمة من نائبة الرئيس من شركة LG.
The global enterprise LG. When you think of LG, what kind of company comes to mind? Electronics, home appliances, communication tools, or maybe display-related products? A lot of things may come to mind, but did you know that LG actually began in the field of cosmetics? The worldwide technology of LG was born out of the worries of people. And ever since that time, LG has pursued the value of beauty in various different fields of business. LG is a company that has researched hyaluronic acid for the past 30 years under the goal of delivering the value of healthy beauty. This has resulted in LG Aesthetics Yvoire becoming loved in different countries around the world. LG Aesthetics will continue to imbue the lives of our customers with beauty. Credible beauty, LG.
Ladies and gentlemen, and distinguished guests, my name is Hezakim, Vice President of LG Chem's Global Aesthetic Business. It is a pleasure to be with you here today. First of all, I'd like to thank our reliable partner Imdad for preparing this event and giving me the opportunity to greet you. I also want to express my gratitude to our guests for coming to launch event of Yvoire, making tonight more special. It is a shame that I cannot be with you on site and celebrate the event together, but it is a great honor for me to send this congratulatory message for our launch in Saudi Arabia. LG Group is best known for electronics, but the origin of LG is chemical business, and we ranked world number 3 chemical company in 2022. LG Chem also has over 60 years of R&D history in pharmaceutical field, and most importantly, we have over 30 years of expertise with hyaluronic acid. With this background, we have developed diverse HA-based products for both therapeutic and aesthetic use. Using our advanced technology, we are not only manufacturing HA products, but also producing HA raw material under strictly controlled pharmaceutical conditions. This high-quality control system made us distribute more than 10 million syringes of Yvoire globally, and thanks to Imdad, LG Chem now can meet the aesthetic expert in KSA through Yvoire. Tonight, I'm very excited to introduce our Yvoire families to you. I hope we can provide and share with you the beautifying solution that many doctors and consumers around the world have experienced by using Yvoire. Once again, thank you very much for joining us in this historical journey, and I hope you enjoy the rest of this event. Thank you.
ليتحدث معنا اليوم عن ميزات إيفوار وليستعرض معنا المحتوى العلمي لهذا المؤتمر ويعرف عن أطبائنا الزوار، أدعو إلى المنصة الدكتور مدحت شورى، مدير قسم الحقن التجميلي في شركة إمداد، فليتفضل مشكورا.
Bismillah ar-Rahman ar-Rahim. Allow me to make my speech in English because I will be connecting you to our esteemed speakers for today. I had been in the aesthetic industry since 2012 with many global brands in the region between Saudi Arabia and GCC that give me the knowledge and understanding how important and different is the Saudi market. In fact, the Saudi market in aesthetic is different in terms of the skills of the practitioners and doctors and in terms of awareness of the consumer. I'm very happy coming back to the Saudi market in business with Imdad, your aesthetic partner for the last 30 years. As Mr. Tamer, our CEO, mentioned, in Imdad we don't choose any product. We don't choose another product. We need always to have the product that will be adding to you and to your patient. Yvoire from LG is not just a new filler, it's a high definition filler. Tonight, we will take you in a small journey explaining the technology of manufacturing of Yvoire specifically, and the reflection of the manufacturing technology and the clinical outcome. We need to understand what kind of technology behind each filler that will help you choose better your treatment tool. Tonight, our esteemed speaker, I would like to introduce Dr. Salvatore Fondaro, Professor of Surgery, Sassari University, and a consultant plastic surgeon. In the first part of the presentation, he will take us through the product specification and the advanced highest technology of Yvoire. Behind the camera from Vienna will be with us Dr. Markus Handel. Dr. Markus is a certified accredited plastic surgeon practicing in both Austria and Switzerland, and he's the CEO of Pure Cell Medical Education and Training Academy. In front of each of you, there is a flyer. It has a QR code. Please scan the QR code with your mobile. When you scan it, and during the first presentation with Dr. Fondaro, there will be popping up on the screen some questions. Please share with us your opinion and your answer to those questions as part of the educational program of tonight. Then results will be anonymously shared on the screen. The purpose is to simplify the understanding of the manufacturing technology. The last and most important part for me in such events is a question and answer session. This, for me, is the success of the event. So after we finish the presentation, the product knowledge part, and the clinical session, please, I encourage you all to ask whatever question came in mind. Thank you so much for attendance today, and I call to the stage Professor Fondaro. Please.
Yes.
First.
Good evening to everybody, and first of all, really a lot of thanks to IMDAD for this opportunity. I arrived here in your country 1 week ago, and we have a similar event in Jeddah 1 week ago, and now we have done several workshops, and so I could better understand the characteristic of the market in this country. You know that each country has a specific characteristic. Patient wants specific result, and the features of and the anatomy of the other patients demand different types of treatments. And after this week, I can say that probably this filler is really a very interesting filler in this country, because the requests of your patient are specific, and probably thanks to the urological characteristic of Yvoire filler, you can satisfy the request of your patient. And in this first part of this launch, I will try to explain you why I say this. Because you know that all the company say that the fillers that they have and that they sell is the best filler, of course. Okay, and every filler has a specific characteristic that make it unique. But it's very important to understand why we say this. Okay, so the agenda of this meeting will be this one. Okay, first we will analyze the rheological and the global characteristic of Yvoire, and we will analyze also the different indication and the different possibility of injection we have based on the different type of Yvoire filler we want to use. And then we have a question and answer, and I ask you to if you have some questions, please do them because it's very important for me to have a good feedback from the attendees, doctors, and if you have some doubts, please ask me. And also, if you are not agree with me, you can sincerely tell me this. Then we will have a very important moment, the live injection with in connection with Vienna, live injection by Drs. Markus Handel. Again, a question and answer, and we will close our symposium, and then we will have the dinner. Okay, here you see this QR code. Please scan it because it's very important for us. During the speech, we will have some pool, and it's really important to have your feedback concerning this point because in this way we can better understand if the message that we are giving to you are effective. And also we want to know your previous experience and what do you think about the main characteristic of the fillers that you are using. So let's start with some initial consideration. And we know that when we decide to use a filler, we can do a good choice or a bad choice. Because each filler has specific characteristic, specific indication. And so it's very important to use the good filler, using it with a good indication and inject it with a proper technique and at the level of the correct anatomical layer. So when we decide to use a filler, is an absolutely very important moment. Because if we do in that moment the wrong choice, probably the final result will not be a good result for our patient. And of course, it will not be a good job for us. So, I come from Italy, and you know that for Italian people, the espresso coffee is a very important drink, okay? And so we want to have a good quality, okay? For us, it's very important. And to have a good espresso, we have 5 rules that made possible to produce a good espresso. And here you see that it's very important that the grain are grounded at the moment, okay? And it's very important also that the time of contact of the hot water with the coffee, and of course, if you have add sugar, remember, this means that the espresso is not good, okay? Probably because we was not able to make it in a correct way, or perhaps because the coffee was not of good quality. Then, very important here, the contents in a cup has to be between 14 and 25 cc, for example, and very important to have a long-lasting cream. So, some rules that make the good espresso. But if we use a poor quality coffee, we cannot make a good espresso. The product, the raw material that we use is very, very important. And so it's very important to control the supply chain. And Yvoire is made by LG. LG is a big company. Inside LG, we have LG Chem that is one of the biggest chemical company in the world. Inside LG Chem, we have a pharmaceutical company. Inside this pharmaceutical company, we have the LG Aesthetic. And the characteristic of LG Aesthetic is that they are able to produce both the raw material and the final product, the filler. Because usually the other company are not able to do this. The main part of the companies that produce fillers are able to produce filler, but they don't produce the raw material. So it means that they are not able to control all this supply chain and are not able to control the quality of the raw material. This is a very important point, because I think that this is one of the characteristics of these fillers that probably made the difference. So they had a very important research and development department. They started a lot of years ago. And in fact, they started several years ago to produce hyaluronic acid for other indication as ophthalmology or orthopedic, and then they grew up producing the Yvoire filler. We know that the materials that usually we use for this for the filler is the hyaluronic acid. Now all the company use hyaluronic acid by bacterial fermentation. Okay, but it's very important to use a very pure and sterile product, because we collect the hyaluronic acid from bacteria. So it's very important to eliminate all the proteins that the bacteria produce and maintain only the pure hyaluronic acid. And LG is able to do this. They control exactly the purity and, of course, the sterility of this product. In fact, they have both the registration in the United States and in Europe, and they has been able to produce the third generation. This is the story of the hyaluronic acid filler. Everything started from, started from the first generation. It was a filler from animal origin, with some problem, not good quality, but it was the beginning. Then arrived the second generation, the Restylane generation, and it is again a filler with a specific characteristic. It is a biphasic filler, and we will see what means a biphasic filler. But other company would like to enter in this business, but there was a problem, because the biphasic filler was protected by a patent. No other company could produce with this method of production. So they developed the third generation, the monophasic fillers, because there was no other way to produce this type of product. They cannot copy, we can say, Restylane, because the patent protect this method of production. But you know that all the patent, after some years, expired, and so company can start again to develop this technology and produce again biphasic filler. And this is the first generation that LG Chem with the Yvoire fillers created. As I told before, they started a lot of years ago. You see in 1919, and they developed hyaluronic acid for ophthalmic indication, orthopedic indication, and in 2010 they produced the first hyaluronic acid filler in Korea, and then they spread in China, in Europe, in South America, and now also in this part of the world. So they have a very long story and a long experience in this field. When we decide to use a filler, we have a big problem, because you know that aesthetic medicine or dermatologist is a branch that usually is able to do a diagnosis simply checking our patient, simply doing an assessment of the face of our patient. We have not too much instrument to use. Recently, I started to use the ultrasound to improve the assessment of my patient before the treatment. Is very useful, can help me a lot. But of course, we need to check with our eye and assess our patient only thanks to our vision. And based on what we say, we have to decide what we can do. So we have our patient, okay? We analyze their features, we analyze their aging process, and then we have to decide how to treat this patient. And so we can decide to modify some specific part of a face to improve the look of our patient and to increase a useful aspect of their face. So it's very important in this time to understand what to do, but then we have to understand with filler and how we can make our job. And so it's very important to have an instrument that warrants high definition. We need a filler that warrants a good improvement and mainly of the volume of the face of our patient. Because in any case, when we use a hyaluronic acid filler, we increase the volume of soft tissue, even if we treat wrinkles, fine wrinkles, or deep fat compartment. In any case, we are increasing the volume of the tissue. And so, for a filler, it's very important to have a high volumizing capacity at all the anatomical level. Of course, we need filler with different characteristics in each of these levels. So, the first question that I ask you concerning this point, usually, do you use a monophasic filler or a biphasic filler? Can you answer to this question? Because then we will explain. Okay, now we wait for. Okay. So monophasic is increasing, biphasic is decreasing. Is normal, because as I told you, the main part of the company produce monophasic filler. So it's logic that you often use this type of filler. Someone use a biphasic filler. This is a good news. Okay, so the main part of you use a monophasic filler. Very good. Here I show you, and we start to understand the difference between the biphasic and the monophasic filler. So, this is a biphasic filler, and this is a monophasic filler. The difference between these two types is that after the injection, with the monophasic filler, we have an extra volume or a temporary volume due to the swelling of the product, of the gel. In biphasic filler, here they say we have no extra volume. Surely we have less extra volume. A little bit could be, because all the filler has an hydrophilicity, because we use HA, that is an hydrophilic product. So it's not possible to image a filler without an hydrophilic characteristic, but in biphasic filler, it is lower. And this is the difference between the biphasic filler and monophasic filler. The difference is in the method how we produce this filler. So some companies say there is no difference between biphasic and monophasic filler, but it's not true, because the method of production is absolutely different. When we produce a biphasic filler, we have a block of gel, of hyaluronic acid, quite hard, okay? And then we pass through a sieve this block of gel. based on the dimension of the particle that we create different G prime, different elasticity of the final filler. So inside the biphasic filler, we have particles and a fluid, hyaluronic acid, and the particle are inside this fluid behavior. If I change the dimension of the particles that are inside this filler, I change the elasticity of the filler. Simply modifying the dimension of the particle. Simply changes the sieve that I use when I sieve this, the hyaluronic acid. The monophasic fillers, again, we have a unique block of filler, and then we homogenize this block of filler. And thanks to the homogenization, adding free hyaluronic acid, we find the right and correct elasticity, the right and correct hardness of the gel. So we have two different methods of production, okay? This means that they probably have different characteristics, and now we will see this different characteristic. Okay, what about the rheological characteristic of monophasic and biphasic filler? So you know that the science that study the characteristic of a filler is the rheology. Rheology is a branch of physics, okay? Probably the terms that usually the physics use in this field are not so familiar for us, and probably we cannot understand exactly what they mean because it's a quite complex topic, this one. And I have to say it takes 6 months to try to start to understand something when I started to study this aspect of the filler. So here you see that, generally speaking, the monophasic filler has a lower G prime and a lower G double prime, okay, and higher tan delta. What means? Lower elasticity, lower viscosity, and that they are more similar to a fluid, okay? This means that from the clinical point of view, probably they are easier to be injected, generally speaking, but they have a lower capacity to volumize the soft tissue. Biphasic filler has higher G prime, elastic modulus, higher viscous modulus, G double prime, lower tan delta. This means higher volumizing capacity, lower fluidity, and that they are more similar to a gel. And this means higher volumizing capacity and thanks to the higher elasticity. Okay, these are physical data. Concerning clinical aspect, we can discuss as we want, but if we speak of physics, physics is a precise science. It's not medicine that someone can discuss, and this is our scientific and physical data. Okay, and of course, this different characteristic may influence the longevity, the safety, and the clinical performance of the filler. But as we say at the beginning, all start from the raw material. All start from the hyaluronic acid that we use to produce the filler. And the characteristic of Yvoire filler is that the hyaluronic acid chain that they use is probably the biggest in the market. What means? Means that if we compare a chopstick and a toothpick, okay, they are two instruments, okay, we use this instrument in a different way, and we can say the material is the same, wood, okay, but the dimension is different, okay? We cannot use a chopstick as a toothpick, of course, and vice versa. Okay, so this is the same for the hyaluronic acid that LG used for their filler, because they use a 3 million Dalton hyaluronic acid chain. Usually the other company use a 1 million Dalton. So they use a very long hyaluronic acid chain. For this reason, it's very important that they are also the producer of the raw material, because they exactly know the characteristic of the raw material that they use to produce the filler. But why is it important to use a long HA chain? Is important because if we want to cross-link a long chain, we need less BDD compare the quantity of BDD that we need to cross-link a shorter hyaluronic acid chains. So, using this technology, starting from this raw material, they are able to use less BDD. This is important because we know that BDD is a toxic substance. It can determine inflammation, and is important to maintain the amount of these molecules very, very low. And thanks to the use of a 3 million Dalton chain, LG is able to reduce the quantity of BDD that they usually add in their fillers. The technology that the company use to create the cross-linking is very, very important. We know that the natural hyaluronic acid is a molecule that has a huge biocompatibility. We cannot have adverse reaction, we cannot have allergy against the hyaluronic acid. We have hyaluronic acid inside our body. We produce all the hour of our day hyaluronic acid. So it's recognized as a self material, okay? But you know, the problem of pure hyaluronic acid is that the duration is very short, 24 hours in our skin. So we produce all the days new hyaluronic acid to maintain a good degree of hyaluronic acid. And the aging is due to the fact that due to the aging, we are less able to produce hyaluronic acid. So, to use this material as a long-lasting filler, we need to modify its structure. We need to modify the structure, the molecular structure of hyaluronic acid, and we do this by the cross-linking method. And here is very important to understand that when we modify a molecule, we increase the risk that our body recognizes this molecule as a non-self molecule. So we have to maintain a specific parameter that is the modification degree very low. The modification degree is a stoichiometric measurement. Again, physics, not opinion, physics. We can exactly calculate the modification degree in each of this filler, and we can say how different is the filler that we are injecting from the original and pure hyaluronic acid. And I cannot understand why usually the company don't communicate this data. Because I think that often we receive information, our filler is pure, our filler is sterile, we have a very good cross-linking method, and so on. But nobody show us this data. This means probably that this data is not so good. This means that probably some company have to modify the hyaluronic acid in a very high way to give the biological characteristic that they want in their filler. So I can say that the modification degree of hyaluronic acid filler of Yvoire, of LG, is lower compared with the, with the modification degree of the other company. This means that after injection, even if we use a volumizing filler, we have a low inflammatory reaction. And it's very important to remember that to increase the elasticity, the volumizing capacity of a biphasic filler, simply we modify the dimension of the particle. We don't need to add more BDDE or more hyaluronic acid inside. If we want to increase the elasticity of a monophasic filler, we simply have to increase the HA concentration and increase the BDDE to increase the cross-linking. So we increase modification degree. For this region, it's not possible to achieve a so high elasticity as in biphasic filler for monophasic filler. Or the monophasic filler has a lower elasticity. Because if we add too much BDD, we create a substance, a filler that gives us inflammation after the injection. And here you see, okay, that the different dimension of the molecules of hyaluronic acid gives different types of physic characteristic of the gel. So we have very long chain, okay, and using a limited amount of BDDE, LG is able to create a very good cross-linking process. And thanks to the low modification degree, we have also a good biocompatibility. And they verified this also with some histological evaluation. And we have comparing the inflammatory reaction after the injection of Yvoire contour with another similar biphasic filler, we see that we have a lower inflammation after the injection. But now we focus on the main characteristic probably of the filler, that is the elasticity that is directly connected with the performance capacity of the filler. So, but before to start this part, I would like to ask you, in your opinion, is better to use a filler with a high HA concentration and a filler with a high elasticity, a filler with high cohesivity, or a filler with a high viscosity? Give your opinion about this point. I give you a few seconds. Okay, elasticity is 39. Then we have HA concentration, cohesivity, they are decreasing. Probably elasticity is increasing. Okay. So, yes, very good, very good. So, we can say that the main part of us thinks that elasticity, that is the G prime of the filler, is probably the most important characteristic of hyaluronic acid. Okay? At the second position, we have HA concentration, viscosity, and finally cohesivity. Okay? So, elasticity is important, and I absolutely agree. We can modify the elasticity of the filler, increasing of course the cross-linking. Okay, but it's very important also another aspect concerning the cross-linking. Here you see that we can again calculate if the main part of the BDDA that we add works as a cross-linker or not. And again, here you see that in LG's filler, we have that the cross-linking ratio is absolutely high, means that they are able to create a cross-linking, and the 30% of the BDDE inside the filler act as a cross-linker. The other company usually has a 10, maximum 20% of BDDE that works as a cross-linker. This is again very important because they use less BDDE, but they are able to have a cross-linking with a very high performance. So, we go back to elasticity. How we can calculate the elasticity of the filler? We can calculate thanks to use of a specific physical instrument that is a rheolometer. And the rheolometer apply a shear deformation of a gel. And here you see two different gel. One is a gel with a high G prime, and this one is a gel with a low G prime. So if we apply a shear deformation, we deform, of course, the gel. We change the shape and the volume of the gel, but when we remove the shear deformation, if the gel inside has enough energy, and G prime is an energy inside the filler, it's able to restore its original volume and shape. So for this region, a gel is able to restore the volume of the soft tissue, because after injection, it's able to get again its original volume. But if it has a low G prime, the filler cannot do its job. And so, I'm agree with you, elasticity is probably the main characteristic that we have to consider when we inject and we decide to use a filler. And here you see two different G prime filler. So here we have a high G prime, and here we have a lower G prime. And you see that capacity to support the load that we apply on the gel is absolutely different. Means that we cannot use this filler in the same way. And means that this filler with high G prime give us a higher volumization of soft tissue. And here you see the G prime of Yvoire Classic here and of Yvoire Volume here. And you see that, of course, they have similar G prime with other biphasic filler because the technology that they use is very similar, so they have similar product. But if we compare with a monophasic filler, you see that in any case, when you use a biphasic filler, you are using a filler with a higher G prime comparing with the monophasic filler. So if the G prime is an important characteristic, I can say that it's more logical to use a biphasic filler. And here you see the comparison of G prime between Yvoire filler and some other quite famous monophasic filler. And you see that comparing every types of filler for fine wrinkles, for medium wrinkles, and for volume enhancement, always we have a higher G prime of Yvoire filler comparing with other monophasic filler. But can we achieve a high G prime with a low molecular weight HA? Is possible to do this? Yes, as we say, is possible, but we have to modify too much the molecule. We have to add too much DDE. We increase the risk of inflammation. And so it's impossible to produce a monophasic filler with using short chain because the modification degrees will be too high, and so we will have a problem when we inject the filler. Finally, also the cohesivity is important in my opinion, and the cohesivity is the capacity of the molecules inside the cell to create a link between the other, and so this connection between the different molecules inside the cell determine a high resistance to vertical pressure, and is more is of course a filler with a high cohesivity is more difficult to be spread. And in fact, I have to say that the monophasic filler to balance the low G prime usually try to have a higher cohesivity compared to the biphasic filler, because they have to try to increase this second rheological characteristic that is not exactly a rheological characteristic. But the problem is that we have several methods to measure the cohesivity, because we don't use the rheolometer. We have other methods, and there is not a unique standard method. So when you compare the cohesivity of different brands, remember that probably we have also to know the type of method that they use, because they could be really, really different, and they could give us a lot of different final result. Okay, so another pool for you now, and now we try to understand if the concentration of HA inside a filler is for you an important feature, an important characteristic of the filler. So when you decide to use a filler, you analyze the concentration of hyaluronic acid. Is important for you? Okay. And moreover, which characteristic the concentration of hyaluronic acid can modify? Volumization, longevity, lifting capacity. So we can say that more or less you think that concentration of hyaluronic acid may increase the volumizing capacity and also the longevity. Okay. I have to say that concentration is important in monophasic filler, because it's one of the parameters that they can modify to increase the elasticity of a gel. But in a biphasic filler, concentration is not so important, because we use usually a unique concentration, and we modify the physical characteristic of a filler simply, as we said before, modifying the dimension of the particle. So HA concentration is an important characteristic, but only in case of monophasic filler. But we know that if we increase the concentration of hyaluronic acid, we are increasing the concentration of a hydrophilic molecule. This means that more we add hyaluronic acid, more we will have a hydrophilic characteristic of the gel. So it is important, in my opinion, to limit this concentration, because more hyaluronic acid we add, more volumizing, more swelling we will have, more hydrophilicity we will have. So in this study, we see that it's important to maintain under a specific limit the concentration, and in this study we see that probably the correct ideal concentration of hyaluronic acid is 20 milligram per ml, the concentration that you find in Yvoire filler. we know that usually after the injection, we say to our patient, okay, tomorrow and after tomorrow, okay, you will feel a little tenderness, you will see edema, okay, but don't worry, it will decrease. Then, after 2-4 weeks, you will have the natural and the final result, okay? So, usually, we have to undercorrect the defect because we know that we have an increasing of the volume of the gel after the injection, and then after 2 or 3 weeks, we have the final result. This is due to the fact that the main part of filler has a high swelling ratio. Again, another physical text. The swelling ratio indicates the capacity of the gel to bind the water molecule, the molecule of water. Okay, and thanks to this test, we can understand if the concentration, but also, very important, the type of cross-linking determine a filler with high or low capacity to bind the water. And this is the test. We add saline solution to a hyaluronic acid gel. Then we centrifugate. So we mix water and hyaluronic acid gel. After this, we wait for 48 hours. We wait that we have a sedimentation of the gel and water. And here you see that adding dye to this mixture, we see that the color spread, of course, where? Inside the water. It cannot enter inside the gel. And so we can understand if a filler is hydrophilic or less hydrophilic. Here you see that a higher part of water is outside the gel, and here a lower part of water is inside the gel. This means that in case of high concentration of hyaluronic acid, we have more water inside the gel after the injection. And the swelling ratio of Yvoire filler is lower than other products. This means that the result we have at the end of injection is the result that we will have the day after. We don't need to undercorrect, but we simply need to correct, and we'll be sure that the final result will be what we have immediately after the injection. Of course, we can have swelling, especially in some part, as lips, because lips, we know, is quite easy to have swelling, or at the level tear trough. And again, I noted that here you have a high request of tear trough correction. And sincerely, you have physical characteristics that made this type of treatment, in my opinion, very difficult. Because in Caucasian patients, usually we treat tear trough due to the aging process. So modifying the surrounding tissue of this area, for example, the medial soup, we are able to improve the tear trough. In this country, a lot of patients have the congenital tear trough because in your country, main part of the people has a very short tear trough ligament, or perhaps the orbicularis oculi muscle is directly attached to the bone. So you don't need the aging process to have a tear trough. And for this reason, mainly the lady asked to correct this defect. But it's a very difficult defect to be treated because we have no space between the bone and the muscle. So it's quite easy to have sometimes the superficial migration and have permanent edema that we have to resolve injecting hyaluronidase. But hyaluronidase eliminate all the filler that we injected. And so the patient asks again, okay, you solved the edema, but I have the same defect that I had before. So this is quite complex and difficult treatment. And in this case, it's very important to use a filler with low swelling ratio. Because in this case, it will bind less water and we will have less edema after the injection. Of course, treat this area very carefully, use not too much filler, perhaps treat this area in 2 steps, because the first steps we understand what we are doing, and the second step we can refine the result, but without adding too much filler in any case. But if you want to use a hyaluronic acid filler in this area, you have to use a low swelling ratio filler. We know also that it's important to also have a long-lasting result. All our patients ask us, doctor, how long it will be the duration of the treatment? Of course. I don't know if the long-lasting duration is a good business for doctor, okay? Because if I treat my patient is happy for 1 or 2 years, okay, probably he will not come back to my clinic, okay? But this is, of course, not a medical reason, but we have also a medical reason to avoid a too much long-lasting result. Because if we have long-lasting result, we can have long-lasting complication. And we treat an aging process. We treat with modifications at the time determined in the face of our patient. So, some correction may be good 3 years before, but could be not appropriate 3 years after. So we need a limited duration. But believe me, when I started to use the ultrasound 1 year ago, and I could check that an important part of filler that I injected the years before in my patient is still there. We have not a complete absorption. And this we have to keep in mind, especially when we inject too much syringes. Because all what we inject partially will stay for a long time in the face of our patient. And so it's important also to have a filler that with a limited amount of filler give us a good volumization. So we not have to add too much filler that will stay for a long time in the face of our patient. And longevity, of course, is directly related with the cross-linking process. Because if we are able to create a good cross-linking process, and especially using long hyaluronic acid chain, we are able to block the penetration of hyaluronidase inside the gel. Because the hyaluronidase is not able to enter inside if the network of hyaluronic acid and BDDs is a very effective network. And so, again, the quality of cross-linking is very important also for the duration of the final result. But we know that a good resistance to hyaluronidase is important, but sometimes we need to eliminate our filler in case of permanent edema of a lower eyelid, or perhaps in case of intravascular injection. In that case, it's very important to be sure that we can eliminate completely the fillers that we injected. And so it's important also to test if the gel that I'm using is dissolved and degraded by the hyaluronidase. And here you see this test, adding 2,000 units of hyaluronidase, you see that it's possible to dissolve completely the filler. In my opinion, this is a test that we have to do every time that we use a new hyaluronic acid filler, especially if it's produced by someone that we don't know exactly if it is a good producer. And I started to ask to the company also to give us this data, because there are some articles that checked the different amount of hyaluronidase we need to dissolve different type of filler. And this amount is different based on the different brand that they tested. And we need to know this, because if I use a specific brand that needs more hyaluronidase than another, and if I have an intravascular injection, I absolutely need to know if I have to use more hyaluronidase or less hyaluronidase to solve my problem and to solve the problem of our patient mainly. And finally, the injectability of the filler. I said at the beginning that the biphasic filler has higher elasticity, but they are firmer. Is more difficult to inject this type of filler because we have particles inside and we have friction between the particles. And to improve the injectability of a biphasic filler is very important. First of all, insert small particle between the big particles that reduce the... Yes, I'm finishing, don't worry. The small particle between big particles to reduce the friction. And this is the method that LG used to increase the injectability. But also very important to use particles with uniform and homogeneous dimension. Because if we use inside the gel particle with different dimension, we have a less injectability of a final product. And here you see that with this method, we can spread the particles. You see that in Yvoire Classic, we are smaller particles than in Yvoire volume, but it's very important to see that the dimension of the particles is homogeneous. And in Yvoire Classic, we have particles of 400 and 500, and in Yvoire volume, we have particles around 900 micromillimeters. So the homogeneous particles warrants a good injectability. But again, we want a test. We want that the physics confirms this data. And here you see the injection force of Classic and the injection force now of Yvoire Contour. And you can see that the injection we need to inject these fillers is lower compared a biphasic filler, a competitor, okay? And you can see also that the force that we need is a constant force. We don't need to push more than reduce the force, then add more because something blocks our plunger. The force we apply is constant and the injectability is very stable. This means higher precision in injection. The same we have for Yvoire Contours, and here you see that we have a constant injection force. Of course, we need more injection in this type of filler because this filler is the filler with the highest G' on the market. And so, of course, it's a filler that needs a good pressure to be injected, but you see lower than the competitors and very, again, a very stable and constant force. Last point, ergonomic syringes are very important, but mainly I think is important the quality of the luer lock, because we want to avoid leakage of the filler. And here we have a very effective anti-leakage lure lock, and so we can, if we screw very well the needle, we avoid the leakage of the gel. So at the end of my presentation now, I ask you to fill this form and to participate to this pool. And the first question is, okay, high elasticity is the key characteristic for the forming and contouring of facial features. Can you say if you are agree concerning the importance of the G prime, the elasticity, or not? Or if you think now, today, that we have no data. People are, okay, now we have, and I'm happy to see that at the end of this presentation, the 100% of the doctor are agree with me concerning the fact that elasticity is a very important characteristic. Then the second question is if the high molecular weight HA requires less BDD leading to better biocompatibility, and of course the main part of you are agree that the dimension of the hyaluronic acid chain is an important aspect, an important characteristic of the filler. Okay, let's try to evaluate the other point. High cross-linking radio result in a firm gel structure which ensure high lifting and volumetric capacity. And of course, again, the main part of you are agree that the cross-linking ratio and the cross-linking effectiveness is an important aspect of the hyaluronic acid filler. But now it's important, and I will do in a few minutes to understand when and how we can use this filler. So we have several indications. For example, volume. Yvoire volume is a good filler for nose, for lips, big augmentation, for nasolabial fold, and also to start to give some volume enhancement of deep fat compartments. Contour is a perfect, in my opinion, filler for volumizing the face, so for cheekbone, for chin, and for jawline definition. And classic is a filler for lips, soft volumization, lip contouring, for glabella line, for crow's feet, tear trough, as we say, and also for barcode. I have to say that Yvoire Classic is not the filler for very fine lines. Okay, is a filler for fine lines, but not for very fine lines. Here you see the difference, a recap of the different characteristic of the three different gel. Of course, today you hear in your country volume classic with lidocaine inside, Yvoire volume with lidocaine inside, and in contour, in Yvoire contour, we have no lidocaine inside. So when you inject this filler, inject it slowly because we have no lidocaine, and injecting slowly, we reduce the pain during the injection. And so we have three different fillers, and of course, based on the G prime, we can use them in a different anatomical level. Yvoire classic at the level of epidermis, at the level of subcutaneous tissue inside the superficial fat compartment, we can inject volume plus Yvoire volume, and Yvoire classic plus. And finally, at the level of deep fat compartment, we can inject Yvoire volume and Yvoire contour. Because you see here that the transformation of a face due to the aging process is absolutely incredible. And here you see how is powerful this process. You see how it can change our facial characteristic, okay? And so we have to manage this problem because our patient ask us, okay, doctor, please eliminate my aging sign. But they cannot understand that we are doing something that is really challenging because the process is absolutely powerful. And here you can see they are old men, okay, with good, healthy body. But if we analyze the face of this man, they was not able to reduce the aging because aging of a face is different compared with the body aging, okay? So we have a big problem because we have to solve a very complex process. So we have exactly understand with which filler, with which technique, and in which level of the face we have to inject our filler. And only to show you some indication, of course, we have several. We have not time to analyze all the indication, but here you see that we can use Yvoire Classic and volume for marionette correction, for example. Or we can use Yvoire volume or Yvoire Classic again for nasolabial fold correction. We can use with intradermal, subcutaneous, or deep injection into the pyriform space. But we can start to use also Yvoire volume to enhance the volume of our patient, and especially I use Yvoire volume when I'm treating a skinny patient with a very thin subcutaneous tissue because I need a G prime with a filler with high G prime, but not too much high because it could create some problem of palpability. And Yvoire volume is great for this type of patient. And we can use also Yvoire volume or classic to increase the volume of the lateral part of the face. And I noted in this day that quite often your patient asks to reduce the concavity of the lateral part of the face. And with cannula, using Yvoire volume, you will have great result. And so we can inject in this way with cannula in the lateral part of the face to achieve also a lifting effect of the medial part of the face. And if we have to increase the volume of a deep fat compartment, the best choice, in my opinion, is the Yvoire contour, so the high volumizing filler, injecting or with needle if you want, or perhaps using the cannula. That is, in my opinion, is safer and is very important to be sure that with cannula we are able to inject the deep fat compartment and then inject as we do with needles. So I think that this is another option. Of course, you can decide the best technique that you want to use. And also for chin augmentation, we can use this filler, the Yvoire contour, into deep plane between the two mentalis muscle, or perhaps we can combine also the augmentation of the chin, injecting into the superficial fat compartment of this area Yvoire volume using a needle, or better perhaps a cannula. So these are only some examples of use of this filler, and after the break we will have a live injection from Vienna, and surely Dr. Marcus will be able to show you more injection technique. Okay, so I close my presentation showing you the lifting capacity that we have if we are able to restore the volume of the face of our patient in the right position. And you see that simply restoring the volume, we are able to lift the skin, as you can see in this short video, and this is a very important aspect because often we need also a lifting after, and this is the lifting capacity. That is not a rheological characteristic, but is a capacity of the doctor to be able to inject correctly in the right position the filler. Okay, about the conclusion, we can say the elasticity is probably the most important properties of the filler. Very important to use a filler as you are with a low BDD concentration because this increases the biocompatibility. The efficacy of cross-linking is very important because increase the longevity, and the injectability is very important because the injectability gives us a higher precision of injection, and so we can achieve a higher definition of the face of our patient. For this reason, we call and we describe Yvoire filler as the high definition filler. Okay, question and answer if you have someone, and then thank you very much. So, if someone have some question, yes, microphone is arriving. Okay.
Thank you very much. Thank you very much for an amazing talk and presentation. It looks very promising compared to other products. I have a question. If you would inject with cannulas, which cannula size for each product that you would do?
Sorry, if I inject with cannula?
Sure. If you would advise about the cannula size,
okay.
If I'm going to use a cannula for each different product.
This is a very important question.
Thank you.
First of all, inside the box, we have in Yvoire Classic a 27, a 30 gauge needle. Usually I use the 30 gauge needle, okay? In volume, we have a 27 gauge needle, very good. You can use also a 29. Someone use also a 30 gauge needle. But 27 or 29 is okay for volume. In Classic, you have a 23 gauge needle. 23 is absolutely unuseful, okay? I try to convince LG to change this needle because you can usually use easily a 27 gauge needle without problem. Okay, so I always change the needle that I have in the box. Yes, inside the box. No, in my opinion, is why they use this needle?
Yeah, so how come you have 23 gauge needle in a Classic?
Because I started my collaboration with Korean people more than 10 years ago. Okay? They are fantastic people, very kind, clever, and so on. They have only one defect, the rigidity. They are rigid, like German people, okay? If they research and development department say that the best filler, this needle, is 23 because it absolutely don't modify the structure and so on, we have a very low force injection and so on, there is no way to convince them that perhaps they can change a little bit the dimension of the needle, okay? So okay, now I'm joking, but it's really so. And I have to say that based on my experience, 27 works great.
Yeah, okay.
Okay, was absolutely. Thanks also to the good lure lock that they use.
Okay, thank you.
Concerning the cannula, sorry, because the question was concerning cannula. 25 gauge needle for Classic and volume. I prefer the 23 or 22 cannula for contour, but if you want, you can use also a 25. It's a little hard to inject it, but in this week we did several injections during the workshop, and also the ladies could inject easily the filler through a 25 gauge cannula.
Okay, thank you.
Assalamu alaikum. Yes. Actually, now I have 3 questions. Why monophasic filler give me excess temporary volume? The monophasic filler.
Yes.
Why it give me a temporary excess volume? I can say.
Can you repeat, because I cannot get...
The monophasic filler.
Yes.
It give me extra volume, temporary. It will fade away, like Pepsi. That's the picture I saw, right? Why it give me this? Why it do this? Why it do this? Why it do this? Why it give me this extra?
Why they give this extra volume?
Yes, yes.
Okay, because inside the monophasic filler, usually, not always, you have more hyaluronic acid, okay, and and this determine a higher swelling ratio. They are able to bind more water. Okay, so you inject a gel. The gel start to bind and catch water, so it increases the volume. Okay, and gives usually also swelling in the surrounding tissue. Then, after some weeks, the molecules of water start to get out from the gel, because we have a reduction of edema, and so we have a reduction of volumizing capacity. In fact, sometimes it happens that the patients are very happy the day after the injection, then they come back and say, okay, but in 2 or 3 weeks, I see that my defects is coming back. Not completely, of course, but the perception of the patient is that the filler that you use is not a long-lasting filler, because they see that they have a recurrence of the defect quite fastly. For this reason, in my opinion, is to get the final result during the injection and have a stable volume augmentation the day after. And to evaluate the swelling ratio, we have that test. So it's important to, of course, we cannot do, but it's important that the company do this and give us this information, because we need to know the swelling ratio of each filler we use.
So I can say it is simply like blender. It is like blender. Give air in the juice.
Because, sorry, I have a bad
so it's like
echo.
A blender.
I can.
She said, is it like a blender?
It is not a vacuum.
Okay. What
it is like blender. Like I am making juice. So air now inside the juice.
Yes. No. The example was because with bubble you have an extra volume that decreases with time. If you have no bubble, means that you have not this extra volume. Sorry, but I have a very bad sound in this part. If we have no more questions.
She's asking about what is the percentage of the fibrosis in reality?
Fibrosis?
I'm caring about the defect.
I hope 0. No, usually I have to say that if you have fibrosis after a HA injection, means you have an inflammatory reaction, means you had a granuloma reaction, and that give you fibrosis. Okay, but usually if you have not this time, you have not this problem after a HA injection. Yes?
About contour and volume.
Yeah.
I can say that contour type is more thick than volume. I can use in bone for lifting.
Yeah.
So I understand this in the right way?
Okay. For volume, not for lifting, because lifting and fillers are two concepts that are not directly related. Okay. The concept is the two concepts are volume and filler. And so contour gives you more volume, and if you use in a proper way, give you lifting. But if you use in the wrong way, give you no lifting.
Because I select the site.
Yes, the site injection is very important in my opinion. And for this reason, I love anatomy applied to this science.
Thank you.
And also the type of skin, thin versus thick. In
Yes.
thin, we will not use the contour, I think, in the thin
So
skin.
in this country, perhaps the best choice is contour for your patient, because we have thick skin. You have, fortunately, also good quality of superficial and deep fat compartment. Really better compared with the Caucasian patient, okay? But to achieve a good volume augmentation, and for example, a good definition of a jawline, you need a filler with very high G prime. Even if you inject and you see no difference, okay? And I think that here you will use more contour than other type.
Please.
Where?
Here.
Can you? We have an. Oh, okay. Can you stand up because so I can see you?
Please, what is the side effect of injecting monophasic filler on previous biphasic filler?
Oh, yes, okay. You can inject biphasic filler, monophasic filler, or also in the same section if you want. We have no problem because both have hyaluronic acid filler, so you have no type of interaction. Absolutely.
So no side effect. No side effect.
No side effect if you mix. No,
Thank you.
Absolutely. Okay. Coffee break.
You know, there was few questions all going around monophasic and biphasic and the clinical reflection of being monophasic or biphasic. Like, why monophasic attract more water? And you answered that. When I'm using biphasic, should I make full correction, under correction, waiting for the edema? All the question going about the differences between monophasic and biphasic. Can you just give a note about, while correcting or giving a volume with biphasic, what we should consider most of all?
The most important difference between biphasic and monophasic filler is volumizing capacity, in my opinion. I'm a surgeon, and I like to modify the volume of my patient. I'm not so focused on the wrinkle, but I'm more focused on volume modification. So a filler with a high volumizing capacity for me is the best choice, of course. The second difference is also the low swelling ratio, because I like to exactly know if I have done a good job immediately after the injection, okay? And this allowed me to define very well the contour of the face, and I don't need to split my treatment into different sessions. And of course, if I use a filler with a higher volumizing capacity, I can use less product to give the same result. So for me, this is a very important, another important characteristic. Okay, coffee break, I think, because I think that all of us are tired. And at what time we start?
Yes, وندعوكم حضورنا الكريم الآن لاستراحة 15 دقيقة في صالة الاستقبال خارجا لتتمكنوا من الاستمتاع بتجربة كورية فريدة والمشاركة في المحتوى الاجتماعي، ونعود بعدها لنكمل إن شاء الله. نرحب مجددا بضيوفنا الأعزاء. سنبدأ الآن بالمحتوى العلمي للحقن المباشر بإيفوار. Dr. Fundaro, Dr. Handel, the stage is yours to start with the live injection procedures. Thank you.
Okay. Oh, we have the connection with Vienna. Hi, Marcus. How do you do?
Hi, Piero. I'm fine. You? Thank you.
Okay. Very, very good. So now we can appreciate the result and the efficacy of this filler thanks to the live injection that Dr. Handel Marcus will do from Vienna. And before your injection, Marcus, I shortly introduced the treatment that you are going to do. And if I well remember, you will treat the cheekbone area, we can say, in this lady, the chin and the jawline. Is it correct?
That is correct.
Okay, so here you see, doctors, the two patients that Dr. Handel is going to treat. The first one is already on the bed, and the second one will arrive after the first live demonstration. So Marcus will treat the cheekbone, the lid cheek junction, and the jawline of the first patient. It's very important to remember that when we treat the mid face, usually we inject the deep fat compartment. Here you see that in this area we have superficial fat compartments and deep fat compartments. Between these two different anatomical layers, we have this mass layer, and in this case, the upper part of the mid face, the upper part of this area, we have the orbicularis oculi muscle, and in the lower part, we have this mass plane that is the border between the deep and the superficial fat compartment. Here you see the main superficial fat compartment of the face, the infraorbital fat, the superficial medial cheek fat, and the nasolabial fat. Laterally, we have the lateral cheek fat compartment, as you can see. And here you see the deep fat compartment, medial SUF, lateral SUF, and the deep medial cheek fat, and finally the buccal fat, that is a very deep fat compartment that usually we don't treat. And when we treat the cheek mid-face, usually we treat the deep fat compartment. Remember that these deep fat the superficial fat compartment usually age by downwards migration and hypertrophy, and the deep fat compartment usually aids by hypertrophy, and usually they have no downwards migration, but mainly in volume reduction. Okay, Marco? So, can you go on, if you want, with the assessment of your patient? Can you describe your treatment? Which type of product are you going to use? And this is your time. Thank you.
Thank you. Thank you for the warm welcome and introduction. Hello to the Emirates. I'm glad and then very honest to present some technical treatments here. They are especially designed also for using the Yvoire hyaluronic acid fillers. The most important thing in the first step of treating a face in a female and also in a male is to analyze, do we have some asymmetries or symmetries? What aging signs do we already see? And where are the major points that may afflict in an augmentation of attractiveness in the face? And one of the most important regions is the eye region. So if what we can see in that patient, if she's looking like straight, is we have some downward sagging in the mid face. So we have a still very good positioned lateral SUF department, but the medial is already losing some volume and some atrophy, and is moving downwards. That also may increase and is also increasing slightly the nasolabial fold and causes in a conflict or in an affliction in the future also downward sagging of the upper part of the lip. So the main goal in her, she is a 30-year-old patient. She is healthy. She doesn't have any pre-treatments or taking any medicine. So we are here in a safe procedure is to replace or to augment the volume loss that we already have in the cheekbones. When I'm just elevating a little bit the cheekbone, you already see the difference, not only to the other side, but what you also see is we are also lifting and elevating the lid cheek junction, and that also may inflict or enhance the stability of the lower lid area. Now, what we also see in the forward atrophy or aging process, the lower lid is coming downwards, and that also takes away some attractiveness in the eye area. So the first treatment that we will perform in this young client here is we will lift and augment the cheekbones or the jawline, the cheekbone here, the os zygomaticus in the lateral part. That is the first point where I will place Yvoire volume. Why am I using Yvoire volume here? Because I want to augment the volume and also want to contour the face a little bit in her area, but in her face, we will mark it very strongly here. So you see a very attractive face and demarcation afterwards. We will start with a sharp needle. It's a 27 gauge needle and using Yvoire volume. Thank you. Always very important, the good disinfection, cleanness of the face. All the clients are coming without any makeup. If they're coming with makeup, they're applied to take it off. We don't have any infection or any inflammatory reactions that are far beyond the material that we're already using. So if she's like just tilting downwards a little bit her face, it's always very important to analyze and treat the face by a maximum of gravitation so we can estimate the result better, and we can even see if we have some asymmetries or symmetries. What Piero or Dr. Fundaro already displayed or explained before, we have to place the material in the deep fat compartment. So we are working here with the needle. I'm pulling backwards my skin and I'm going deep to the bone. I'm already at the bone. To aspirate, I'm just pulling the trigger in the back direction to see if we have some vessels punctured. No, we didn't. Then we place a slight amount of volume. The good thing, because of the high, very high G prime of the material, you see the effect immediately. You don't have to look straight on the syringe to see how much you're injecting, because the important thing is the effect, what you create by putting in some volume. When we go far more medially, we are already in a slightly danger zone because we have some branches of the zygomaticus vessel branches here. So if we go more medially, always take care of or analyze the bow of the os zygomaticus, because we are working in the direction of the bow. We're not working a straight line because that doesn't bring us in an aesthetic terminal of the result. So we're going more medially. We're puncturing again. We're going to the bone. We are aspirating slowly. Always do all the treatments very slowly because the effects of the high G prime material is very strong, is very prominent, and that shows you immediately the projection. If it's bleeding slightly, just put on a little bit of pressure, pulling the skin more posteriorly. That helps you because it breaks through the bleeding line, and that avoids infection and that avoids that the blood is spreading. If you go more medially, we again aspirate, then we pull in some volume here. We are still in a vertical direction, and that helps us place the volume exactly on the bone. What we don't want to have is some migration of the volume, so always be aware of where is the lid-cheek junction, where are the tear trough ligaments. We are placing distally, also inferiorly from them, because we don't want to enhance the tissue. Can I have some marker? Because what we see here is now when our lid cheek junction is here, we have just to place a little bit inferior of that if we place volume. If you place it on the top, we will have maybe some conflict with swelling. We may increase maybe her problem. Maybe she was already suffering from some swelling, let's say in the morning or after being tired. And the most important thing is always start on the lateral, on the posterior bow here. So you already get a very strong definition. We will still increase a little bit more the definition here. That helps us also to define the mid-face volume here and makes the shape more attractive. We will continue with Yvoire volume going more medially. A lot of doctors may then say, okay, wow, we are now getting in another danger zone. We are getting more in the infraorbitalis region. No, we are still far away from that. I'm tilting a little bit my needle. I'm going to a 45 degree diversion, so I get a more homogeneous reaction here. By using another marker, I will show you and demonstrate you exactly where the infraorbitalis lies or comes to lie, and it's exactly that area. So we are in a very good distance. If we mark the legit junction, we have a distance of nearly 1 centimeter. So we are in a very safe zone here. We should never place it too low, because if you're placing volume and the volume is a strong volume and projects a lot, too low, you will enhance the projection of the medial fat compartment of the cheek. That may also increase your nasolabial fold, and that's exactly what we don't want to have when we finalize our treatment. When we're going more medially, still aspirating, seeing if we may punctured already some aberrant vessels here, but we didn't, and then we continue, always reducing more the volume that we are placing. And now I'm on the top, actually in a good direction of the infraorbitalis. What is important now, even if you're aspirating, you still can be nearby vessels or nearby nerves, but what shows you exactly where you are is also some pain or distraction of the patient. So if the patient is distracted and tells you, oh, that hurts a lot, you might be very nearby. Maybe also the foramen infraorbitali is a little bit displaced anatomically. There can be some abnormalities. Always be aware of that. Always be very, very careful not to cause any complications here. Salvatore? Oh, I cannot hear you. I cannot hear you. It's there.
Okay.
Yeah, now I can hear you.
Very good. So only a few questions about how much you injected. Do you inject?
0.7.
0.7. Okay, very good.
0.7 ml.
And can we see the patient on seat position and to check better front view? Okay, to better appreciate the result you achieved with the so limited amount of filler. We can appreciate very well the volume augmentation and the lifting that you determine in this area. Is a really a fantastic result with thanks to your ability to inject in the right position, because you describe very well where you inject and why you inject. It's very important to be very precise when you plan the injection in this area, especially because, as you said, we have also some important vessels close where we are injecting. So, Marcus, the next area that you planned to treat is?
The next area is actually the jawline area. What is always very important is we have the posterior part. It's the direction of the position of the masseter muscle. So if you're like masticating, zusammenbeißen, you see already the projection of the masseter muscle here. That is a very important point for me to get a very, very strong projection. That projection makes the face even more attractive, but that helps in pulling in a diagonal diversion here, the skin or the jawling area or the jawling process here that may develop by aging. So we are stabilizing here, we're making it more markant, we're making it more strong actually. That may cause some pain when you initially inject the volume here, always being aware of using a very strong high G prime product, and that is in that case Yvoire Contour. It's the strongest material actually worldwide that we can use by doing a projection and defining the jawline area. Why am I already or again working in the posterior part first? Because then I will also have some lift effect, some elevation effect, and I'm working then anteriorly, defining more the jawline in the middle area where we have some danger zones because of the facialis vessel branches here. And at the end, we have some here, the mentalis area is also a danger zone we have to be aware of, and we are working at the end here before we're going to the gin in the posterior or in the junction of the jawline to the gin area.
Okay, Marcos, I inform you that this type of treatment is very popular in this country because they usually, the doctor have a high request of jawline definition, so all doctors are waiting for your treatment to catch your secret.
Okay, but it's always very important by using hyaluronic acid filler, we have to prime the needles first. And give me the other needle. Another needle. So we get the volume through the needle, and we don't have any.
Are you using a 27 gauge needle, correct?
Yes, I'm using a 27 because I think it's more easy for you actually to place the volume. The cohesivity of the material is so good developed, so we can even use the 27. I wouldn't go to a bigger one actually. You can use a bigger one, the 23, for example, if you're working with a blunt cannula, if you're defining, if you're contouring more here, but we still want to go through the muscle, we want to go to the bone. So I'm using here a sharp needle, I'm pulling backwards the skin, I'm going through the muscle, I'm again aspirating. Aspirating works perfectly with this kind of fillers here. And then we are placing the stempel and we're pulling in some volume. We always inform the patient or the client to relax, not to force the muscle or the muscle contraction here, because that may cause more pain. We will start with an X amount. Now we already injected 0.5. We will do now very strong projection here because that makes a very attractive appearance here. Maybe your client is already experiencing some pressure here because of the volume that is forcing to irritate not only the muscle fibers and also the nerve bundles in that area. What you can see right now, we have some projection here, but I think we will enhance that projection. We will continue by pulling in more volume here. Again, we are in the same place. You have to inject very deep, and unfortunately, when you're working too superficially, you will get into troubles because then you will see already some irregularities in the subcutaneous fat layer, because the high G prime makes a very stabilized result here. Now we injected 1 ml of the Yvoire contour in the posterior jawline area. If we can just have a look if in a tilted direction, if you combine it the right side to the left side, you already see a very strong projection here. And on the other side, it's very, very smooth ending. Where we're going to continue now is we are going more anteriorly. We still can use the sharp needle, but we just will use it for more 1 centimeter. And afterwards, we will work with the blunt cannula, because then I want to enhance the shape or the angle to form a more sharp definition here. Thank you. Just tilt your head a little bit. Thank you.
So you continue to use contour, is correct?
Yes, we will work on the jawline entirely with Yvoire contour, because we want to get a very strong enhancement here. We want to define it perfectly, and we want not only have a very strong result, we also will get a very long-lasting result. I think it's very important or very crucial also for our clients that they want to get a good quality actually for their money if they're investing a lot of money in such treatments. And on the other side, the less treatments you need, the better result that you get by one treatment, the less fibrosis you're causing, the less inflammation you're causing, the less downwards or downsizing time you're causing, even if someone is working in a profession that demonstrates the face even more. I already injected 1.5. As you can see, we still can use some volume in just to enhance it even more. The good thing of the biphasic filler, as was displayed before, is that we have less swelling. We have very, very little water attraction, and that makes it so extraordinary in combination or in combining it or differentiating it with a monophasic filler. And we already used 2 ml of the Yvoire contour, just placed in 2 points on the posterior part. And now we will continue going more anteriorly with the blunt cannula to demonstrate an even sharper angle and even sharper demarcation. On the other side, when you're placing volume here, you will also lift some skin of the submandibular pescoso or of the neck. So you will elevate or you will enhance even more the effect. That also helps your clients if they have some downward sagging already to shape and to demarcate more. Thank you.
And
I will use for perforation.
Sorry, Marcus. Now, I invite, of course, the doctor if they have some question. They can do this. The question. Okay, we have a question, Marcus, for you. We are waiting for the mic, and so. Microphone is arriving. Perhaps. Few seconds. Okay.
The first injection site was the medial cheek. And you didn't choose to inject the arch of zygoma. You chose to inject the medial cheek. And then you inject the mandibular angle. And it was more widening than your arch. So what is your point of beauty for that injection?
Did you catch the question?
Yeah, I'm fine.
So
no,
actually, yes, for that face, you do the face more shorter because you are widening now the angle.
Yeah, correct. Yeah, the thing is that we have different point of aesthetic focus. So even in, let's say, in South America, we have to treat different way, than in Middle Europe or in your country, for example. It's always depending also on the patient's view, and for the Middle Europe area actually, it's very likely actually that someone wants to enhance more the jawline area because this stabilizes the base more, and the cheekbone area is always depending on, because that is not so searched actually in Middle Europe. But I used in comparison, because therefore is the projection completely different. No, I used in comparison in the posterior jawline about 2 ml of the Yvoire contour product. So you have a very, very strong effect here. We could even go with more volume on the upper part, but just in comparison, we only use 0.7. If we enhance here, we still can do that. But it's always relating also on the wishes of the patient or the client. Was that the question that you sent to me?
Marcus, if you want, you can go on, because Time is
Yeah,
running, and
sharp
then
needle.
if you have another question, I will stop you.
Okay. Some disinfection. Okay, I will use a sharp needle. It's a 23 gauge needle. I'm going to the subcutaneous layer to place my blunt cannula that is first primed. Pull it out. Thank you.
It is a 23 gauge cannula, correct?
Yes, it's a 23 gauge needle, and I perforate with a 23 gauge before, so it's like it's exactly the same entry point and it's the same entry size. I'm putting anteriorly, as you can see already. If I'm tilting my needle here, you see where the end is. The end is already in the danger zone, but we're working here with a blunt cannula. We don't want to cause any bruising or any lesion of the facialis area. So I'm putting the trigger very, very slowly. I can go even a little bit further to make a demarcation, a definition of the jawline here. I'm going more posteriorly. I can work easy in the subcutaneous fat layer to project that area stronger. Already placed 0.6 ml, and I'm going and pulling and going anteriorly and posteriorly and going out. I placed in 0.6 ml. Why didn't I put in more? Because we already have a strong projection here, and if I put in more volume, I will need even a lot more volume here in the junction here in the retaining ligament zone that is connecting here my chin area. Again, this can also be done with a sharp needle, but you will get in a risky area here. You may cause a lot of bruising, and you also may get in a danger to inject in the facialis vessel areas here. If I'm going more anteriorly, we have some genetic deficiency, or we have some adherence of the retaining ligament structure here. So there is some possibility to elevate them. There's some possibility to enhance them, but they will not disappear. We are working again with a sharp needle to using the Yvoire contour. So, and always pulling back or backwards my skin. I'm going deep to the bone. I'm aspirating again. We may have some apparent vessels here. Maybe the client is now experiencing some pressure. I'm working very slowly. The most important thing with that high G' product is work very slowly, because you see immediately the elevation, always aspirating here in that area, pulling it down the trigger. You're injecting slowly, 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 and you already see some elevation here in that area. There are some other techniques, also fanning techniques, also working with a blunt cannula to working in the junction of the chin area, but I think that is always in the behavior of the doctors, possibilities and actually use of technique. What we see if we elevate the face, you will see some dimple here that is always related to the retaining ligament structure here. No one likes this, so we are going here more subcutaneously. We try to elevate that area. We also try by using a sharp needle to dissect the fibers of the retaining ligament structures, and as you can see, that works really well in her, and it helps us like define the jawline better. If we now analyze the jawline in the camera, and if you compare it with the other side, I think we got some more definition than we had on the other side. We have a more bulky or more bulgy area here. We don't have that design. We don't have that pulling force or the pulling direction or effect that we got by using Yvoire contour. We now used about 3.4 ml of Yvoire contour.
Great. And some question? if we have no question, I think that you can go on, Marcus, because I think you have last area that is the chin. Is it right?
Yes, I think the chin in her is very important because she has some asymmetry. She has a smaller and narrower left face area here, and the chin is more elevated on the left side than on the right side. That's pulling more downwards. So we will also try to straighten out this asymmetry by using Yvoire contour. And using, again, in that area, we are using a sharp needle because I want to project it even more. So I'm working now on the other side because I want to first get rid of the asymmetry as far as possible, putting it on the bone, again with a sharp needle, my Yvoire contour. If like tilting down the chin, it already shows it's coming downwards. The projection of the left buccal here is getting better and better.
And are you injecting deep? Is it right?
Yes, again, I'm injecting again deep on the bone to get the maximum of projection here. And don't project in the middle part only, because in her case, like the vertical differentiation or asymmetry was stronger than the anterior projection. The anterior projection is nearly the same in her. So we want to go downwards just first to straighten that out. And on the second point, we will elevate her chin or form and shape her chin. Why was the focus also on working on the chin? Because she is already forming a mentalis crease area here. So she has a very, very strong downwards working muscle force in the lower lip area. And we want to straighten that out. We want to get more free dimension here. We want to get more symmetry also in the vertical line, in the free thirds of the face. So we're getting more aesthetic, pleasing result here. To demonstrating the mentalis area, actually, I will demonstrate a treatment with Yvoire volume, because Yvoire volume helps me deform, form and shape that area even better. And be aware of, again, some marker, please, of the mentalis area that we don't want to touch, or we don't want to cause any bruising or irritation of the nerves here. So I'm still working here lateral from the mentalis here. I'm in the subcutaneous plane now. I'm not deep. If I'm too deep here, you will feel some bulging endoral. If she's like going there with her tongue, for example, I will place some bolus here. I'm working in a slightly fan technique here to get rid of the lateral end of the mentalis crest. And then it's already gone. We will continue, still be aware of the mentalis. I'm plunging it a little bit more medially. I'm going underneath the skin. I'm exactly in that retaining or restriction ligaments here that pulling downwards our skin. I'm working again in that crest. I'm working in a very, very tiny fan. It's nearly no fan actually, that dissects a little bit our fibers here, and I'm pulling outwards. That helps me to deform or to shape it even better, to get a very, very nice projection here. What again is very important, I think we have to demonstrate this. It's not only the jawline or the chin area, not only the mentalis crease, it's also the labiomental fold. And the labiomental fold is perfectly treated by using Yvoire volume because of its still very high G' force and elevation capacity, and we're going laterally in a 45-degree dimension. We are aspirating again. Remember, we are medially from the facialis vessel area, so we are here still safe, but we can pick some branches. So we are just pulling in our volume very, very in tiny amounts, working more proximally in the direction of the angle of the mouth, always tilting a little bit more in the direction of the angle, so we can even elevate the angle, and we are working counterproductive or against the depressor angulioris muscle that always pulls downwards the angle of the mouth. If you're like pulling in a diversion, the angle of the mouth, you can place in some volume directly, so you will get some elevation of the angle.
Okay, Marcus, can we see the patient in seat position, and so we can appreciate the two sides, the untreated and the treated side? Okay, and can you turn the face of the lady so we can see the total result, the value augmentation of the mid face, the definition and projection of the jawline. You have to say, Marcus, that in this day we treated several patients during the workshop, and 100% of the patients asking for jawline definition, chin augmentation, cheekbone augmentation, and absolutely lips, because lips is probably the favorite treatment here in this country. And so, Marco, if you are agree, you will treat the other side next alone, we can say. And so I do a short presentation concerning what we will see after and what we have seen now, and so you can change the patient. Is okay?
That's great, thank you.
Okay, thank you very much, and thanks you to your patient, as always, a very beautiful woman.
Thank you.
Okay. So only a few words about what we have seen. You saw that Marcus treated also the lower lid. Very important to well know the anatomy of the orbicularis retaining ligament. The orbicularis retaining ligament is a ligament that connects the orbicularis oculi muscle to the bone. And here you see a video. Oh. Can you start the video? Okay, so here you see a video dissection, okay, of this area. So we dissected the skin. Here you can see the orbicularis oculi muscle pushing on the orbit. We identify the retroseptal fat here, and to show the orbicularis retaining ligament, we have to cut the orbicularis oculi muscle, as you can see, and here you start to see the orbicularis retaining ligament. This is the orbicularis retaining ligament. Here you see the muscle, the orbicularis oculi muscle close to the bone, as we said before, because the length of the orbicularis retaining ligament is absolutely shorter in medial portion of this ligament. This is the orbicularis, the lateral orbital thickening. That is an adhesion of the orbicularis retaining ligament at the bone on the lateral part of the orbital rim. So it is very important to inject the filler always caudal to the orbicularis retaining ligament. Concerning the chin and the jawline, of course, usually we have an aging process due to the downwards migration of the jowl fat compartment. They are both superficial fat compartment, and we have a superior and inferior jowl fat compartment, and they usually migrate downwards. This determines the jowl defect, and I use quite often a similar technique you saw by Marcus, starting the injection at the level of a cheekbone, because this stretches the skin, and then injecting at the level of the angle of the mandible, laterally to the chin, and then along the pre-jowl and the post-jowl defect. So we have this five-point techniques. That is another option. And finally, again, concerning the chin, we can treat, as we saw, deep with contour, and also treat superficially. using volume. So we can do a technique that often is named sandwich technique in this area, and I think at the level of the chin is very important also to block the mentalis muscle before 1 week because with botulinum toxin. Here you see the injection of deep fat compartment of this area with colored filler, and this is the injection of a superficial layer of the chin. And cutting, here we can see the two different layers of injection, the deep layer and the superficial layer. About the lips, okay, the second patient is the patient that will be treated in this area, and Marcus will start the treatment directly with the lip. Of course, very important, remember the characteristic of the natural lips. We have a bump in the middle, in the upper lip, a flat part intermediately, and a rolling zone laterally. Remember that in the lower lip, the bump is not central, but is lateral. Here we have a cleft, usually, and we have to maintain this characteristic if we want a natural lip final result. This is one option, contouring bolus to define the central part of the upper lip, and the same for the lower lip. But when we treat the lip, we have several options, several different techniques. This is another with a combination of fan injection technique, as you can see. Another version with more vertical fan injection technique for a higher rotation and protrusion of the lip. And then we have several types of treatment. We have the pari lips that mainly concentrated on the contour definition and the enhancement of the column of a philtrum. Here you see, then we have the California lips, probably means too much sometimes, because you know that USA usually, American people are exaggerated in their request. Then we have the Russian lip, the famous Russian lip now made by vertical injection. But remember that it's very important, don't exaggerate, don't follow the request of your patient. If someone wants something like this, I think that is a Photoshop. It's impossible to create this type of lips with a filler, but okay, you know that people see these things on internet and they can request. And of course, remember, bad lip filler are not bad luck. So always, before to start the treatment, try to evaluate with attention the characteristic of the patient and select the good product to avoid this type of terrible and bad result. Okay, so Marcus, please. Okay, may I have the connection again? Okay, so Marcus, as I told you, the lips treatment is absolutely highly requested in this country. I have to say that they like quite overcorrected, we can say, lip, okay, and for me it's quite strange because I have to say that here ladies have natural, very beautiful lip, absolutely better defined than the Caucasian patient. And so everybody is waiting for your lip treatment, and so please go on. Thank you.
Thank you. Thank you. Can you see me well?
Yes.
Perfect. Okay. As you already demonstrated before, now the lip is defined of different portions or different center, core, and lateral parts. We know a lot of different techniques actually. Also here in Europe, now we are using fanny techniques. We are using the Russian lip technique. We are using the vertical technique. It always depends on the natural structure and volume that we already have in our clients. We see already a very nice pronouncement. Just open a little bit your mouth. of the lower lip center part here. She doesn't.
Marcus,
just
can you show
yeah?
the patient in sit position, please? Okay, it's perfect. Thank you.
Okay. No, again, she has a very nice projection and also rolling effect on the lower lip areas here. On the upper lip, she has some deficiency of the volume in every part, actually. Her tubercular are not so strong, so like our core may be defined and elevated and enhanced. So I think we will use a combined treatment in her, the combination treatment. No, okay. The combination treatment will be a volumizing in a deeper structure in the core center of the lips here by using Yvoire volume, just to stabilize, to reshape, to form the lip like she maybe was before, or even more in her case now. And we will start with Yvoire volume. After again priming the syringe, we will just elevate a little bit her head. Just open your mouth slightly. And I'm always starting in the lateral part. Again, I'm working in the junction of the dry and wet vermilion. I'm going in, I'm placing in some points here. I'm going more anteriorly, I'm pulling backwards. I'm working in a linear direction right now to placing in some volume to enhance them. I'm pulling backwards again, working on the junction of the dry to the wet vermilion here, and going anteriorly and posteriorly to having a smooth appearance here. And this is just for volumizing the base or the center core of our lips. If I'm going to the other side, I'm working in the same direction. Why am I careful right now by starting up with this lip? Because the product Yvoire volume is a very strong product. We will get at the end of the result a very strong enhancement and definition. The lidocaine helps us diminishing the pain that the patient is experiencing. I'm going more medially. I'm just now in the third point, actually, entry point, to project that area more. What you still may not like is we don't have that rolling effect. We don't have that strong projection here and definition, but that will come in the second step of the treatment. But it's already, if we are now tilting downwards here, our lips, we are already getting more projection and more volume. Just to compare it actually with the lower lip, we are still continuing with the volume, Yvoire volume, and now placing in some more underneath the tubercle. If I'm working here underneath the tubercle, I'm more superficially, I'm more in the subcutaneous plane here to get more definition here. I'm working on the other side, and then I will continue with Yvoire Classic, because then I will elevate and enhance it even more. A lot of our doctors are working with also the vertical technique here. The vertical technique just lifts up the lip, but it doesn't make it more round shaped. I want to get a round shape result in her, even though with a very strong contour. And I will work now with the Yvoire Classic. I'm working with a 30 gauge needle now. I'm again entering in the lateral. It's now the skin and vermilion junction here. I'm not fanning here. I'm working in a linear direction. I'm working anteriorly and then posteriorly. Going more anteriorly, working very subcutaneously, as you can see. That may cause some pain, but also causes more and more definition in that area. As we already experience, or as we know in her anatomy doesn't have a very, very sharp angle, a very sharp definition. We will never experience that in a client that doesn't have that anatomically, but we have a lot of differences or differentiations genetically. So we always have to adapt to work in different patients with different techniques. I selected this technique because, in my opinion, her ground shape was good, but the projection could even be better, and primarily the volume had to be enhanced in her. And as you can see, if you're working exactly in that conjunction to skin and vermilion, the volume stays in that area and it's not migrating. A very, very big fear of a lot of us is when we are injecting the lips is, where's the filler going? And now, is it migrating? Is it going more in the perioral region here? Then it may cause some elevation, some pumpy areas here that we don't want to produce. What we can now continue with is still with the Yvoire Classic, because now we want to work on the surface to getting even more definition and even more elegant appearance. And now I'm working in a fanning technique. So another technique as already used before. So now I'm working in the subcutaneously, I'm working with a fanning technique to getting more elegant round shape projection here. And I'm going to the other side. For sure, the lip will bleed a little bit. We cannot avoid that completely. And we still continue by fanning. Again, I've used that technique, that combination technique, because I already had a very good vertical dimension of the lip. If I have a very tiny lip area, or if the lip is so tiny that I hardly see a vermilion, I would prefer to use the vertical technique to lift the entire surface even stronger. At the end, I will work in the heart, in the center core here. Again, we cannot always make a very, very strong definition here, but I think if we compare the before and after, we already see a very strong difference here. And if you compare it with the lower lid that was bigger before the treatment, we see now, I think, the difference. Can you see the difference?
Often you combine the two different G prime filler when you treat the lip?
In female, yes. I often combine it because I'm working in the core of the lip to volumize it first, and then to contour and define the surface and the definition at the end of the lip. Yeah, I think it's a good way, to work with two different G-prime fillers, because so I can get even better results. In male, for example, I'm working more with the volume. I hardly use the classic, but the male clients often want a different result, that they are more careful, or they don't want to get too exaggerated lips because of the volume and female appearance.
Yes, I absolutely agree with you, because I think that the perfect filler for the lips is not only one type, but I would like to have a box with inside two 0.5 ml of syringe, one of a lower and one with a higher G prime, to combine, to have the possibility to combine the two different G prime during the treatment of the lips. I think that is very, very important to do this. Yes.
Yeah. For example, just to compare it with the first patient that we treated, we didn't treat the lip. She was already treated just in the lips, and that was a vertical technique. And as we saw before, or if we maybe can then switch back or combine the two patients again, she didn't have a lot of volume showing in the lips, but she didn't request that. And that is very important, that we already discussed before. There are, in every part of the world, actually, a different point of view and different need. And so we always have to adapt. And I think, therefore, it's very important for us as doctors to know different ideas, different techniques, because only with different techniques we can treat a different clientele or a different client. So we always have to adapt. Yeah. I think I will continue now with the lower lip. As we already can see, the surface is differently in comparing to the wrinkles that we still have on the lower lip area. We will continue with the Yvoire volume and going to the center core, or to the tubercle, that are placed more laterally, as was already displayed before in the presentation. Why am I using again a sharp needle? I'm going to the center. I'm going about 3 millimeters deep I'm placing in volume very, very slowly. And already can perceive some projection here. I'm going parallel to the other side. I'm leaving alone the center because I think it's also very attractive if we see still some dimple here. But if the need or the wish of our clients wants a more homogeneous reaction, it's not a problem, especially in her, to fill that gap up. But again, there are different point of views what is aesthetically pleasing in a lip. If we are just tilting a little bit the lip, I'm pulling again, I'm always pulling the skin as I did in all treatments before, because then the penetration of the needle is faster and more direct, and it's causing loss pain in the patients. I'm going more laterally, I'm tilting even more my needle. I'm still working in the center part of the lip. I'm not working superficially here. And what I don't actually like is putting in too much on the lateral part, because then it's causing a bulging here on the lateral side, and that makes actually the lip less attractive. But we still can, if that is a desire of our patients, also putting in more volume here. If I'm going more laterally, again, by using Yvoire volume here, putting slightly and very slowly the volume here, I placed in another 0.7 in the lower lip. And now I will again recheck, recontrol the upper and the lower lip by closing the mouth. And what we still see, we need some volume in the lower lateral parts on both sides. It's also marked by this still seeing vertical wrinkles here. So I will still continue with the volume. I could also already switch to Yvoire Classic, but I think I will make a mix here of getting in a little bit more volume and enhancing it at the end. I will work with the Classic to smoothen that area out. And other side, please. There are some risky points here. If you're placing volume too nearby the border, it may shift downwards, and it may cause some bulging in the region of the mimic muscle on the depressor angulioris and also of the depressor labii inferioris. And that may cause not as a discomfort, it's like a maybe complaint of your patients, because then they tell you, why am I now more volumized here in that area that doesn't look even good? Just open your mouth again. Always check by palpating if there is some volume too much in some area, but that's okay in her case. And I will finalize that lip with Yvoire Classic. I'm trying to get the sharper contour here and even out more the lateral parts of the lip. Thank you. As a right-hander, I'm tilting again the lip or the head and open a little bit. And I'm always telling them, please open a little bit your mouth, because then they are more relaxing. If they're closing the mouth, they maybe bite actually, or pulling it together, forcing it, because maybe there's still appearance of some pain in that area. So I'm working more superficially in the subcutaneous layer to getting rid of my still seeing wrinkles here. And what also is changing in that kind of techniques is we are also elevating the angle of the mouth, because we are stabilizing the gap, or we are stabilizing the connection here of the lower lip to the upper lip. And that also may enhance here a very friendly appearance. So, and we will finalize with some more contouring, starting in the middle, starting at the tubercle. I still didn't inject the center part of her lower lip, because I think we will analyze that at the end. I will go in the anterior and posterior direction here. You already see some demarcation here. We have more definition here now of the border, and we now going to the other side here. So, and again to the other side now. And I'm injecting here again. what we can see is during that treatment, we see immediately a stronger rim, and that rim shows us, okay, she is attracted to get a treatment that actually stays in that area, and it is possible in her case to define a little bit more the demarcation. If we sometimes see very tiny dimples in the lateral part that often occur actually, we still can work with the Yvoire classic more superficially, placing in very small boli to even enhance or to smooth it out more. Disinfection. Danke. And close your mouth, please. Yep. Okay. What do you think? Should we still enhance her volume, or what does our auditorium think?
Yes, I think that I would like to ask if someone have some questions. I think that you introduced a very interesting topic, the combination of two different G prime filler in lip augmentation, because I think that is absolutely correct to have the possibility to combine two different G prime. So I'm asking to the doctors if they have some question about the lip treatment. No, we have no question. So now can you show us the final result? Okay, and how many fillers, how many mLs do you use?
We used about 3 ml of Yvoire volume and 1.2 of Yvoire classic.
Okay. Okay, so do you plan to treat some other area in this patient?
What I think what she would benefit of is still again the cheekbone area. Okay. Why? Because she has some volume loss in the medial sooth area here, in the medial molar fat pad area here, and she doesn't have a lot of definition actually from the upper to the from the middle to the lower third of the face. So if we want to make her a little bit more attractive, we can work on that area by using Yvoire volume, as we already used before in the other patient. She doesn't have any nasolabial fold. She's 20 years old, so that doesn't make a sense to work in that area, but she already has some sagging, some atrophy, but this is also genetically related, and I think we get a good enhancement here.
Okay. So you have more or less, I think, 10 minutes, is right? 10 minutes, okay, very well.
I think maybe also for the post-treatment of the lips is very, very important to tell your clients that we have the maximum of the swelling in the first 24 hours. It's very useful to use some ice during that time period to getting rid of that, and in the maximum of about 3 days the swelling is nearly gone, so everyone can see the result, but without still a lot of swelling in that area. If I'm just placing on the lateral part of the cheekbone here on the bone, I'm still aspirating again. I'm not using the Yvoire contour in her. Why? Because that may be too strong for her. Because first, we don't need such a lot of projection, such a lot of definition. We are going more medially. We are always aspirating here. And placing in very small amounts and without a lot of pressure. If we are going more anteriorly, I think one of the questions before was, why did I inject that areas? Yeah, because that is one of the major areas that causes the downward sagging and the atrophy of the medial part of the fatty tissue. And it's also very important to place volume in that area, because when we have some volume loss in the direction of the lid-jig junction, That increases all problems. If we are not volumizing first the base is always the main focus, and then the lifting or the junction area to be treated. I'm going more medially. As we already said before, we are still in a safe place here to the infraorbitalis, but still always aspirate to avoid any problems here. If we see now the effect, you already see some lifting effect, some lifting capacity, not strong enough on the lateral part, so it will continue on the lateral part with some puncturing. Why am I not using in her, for example, a blunt cannula? Because with the blunt cannula, I'm getting more a fanning technique, or this is more used for fanning technique actually in the midface area. That works perfectly. You're not harming vessels here. You have less risk of bruising, but I want to place the volume on the bone. I want to get the maximum lift effect. I want to get the maximum volumizing effect here. And I don't want to get a smooth appearance. I want to get a sharp appearance. So I'm still working here. In my opinion, it's a little bit too less, what means the projection here. I'm placing in more volume here. The lifting effect is coming immediately. And what is also very common is going more posteriorly. So if someone likes it more pronounced, the arcus bow in the posterior part, yes, you can do that, but be aware of all the vessel structures that are now showing up in that area. I'm still on the bone here, always aspirating that area. That may cause some nerval irritations here. And I'm pulling outwards my syringe. We placed in 0.9 ml, also nearly one syringe, just in her to define the face in that area.
Okay, so can we see the result you achieve and with the frontal view of the patient? Yes, it's very evident the lifting effort that you achieve, and I have to say that quite often here in Saudi Arabia, the patient asks also for the treatment of the more posterior cheekbone to have a higher lifting effect, and also the lips are absolutely very natural, well defined, and also the cupid's bows improved a lot with a higher definition. So, Marcus, if I will understand, usually you prefer needle when you treat the cheekbone, and you use more cannula when you treat the central part of the cheek, we can say.
I have 3 areas where I love to use the cannula. It's the tear trough area.
Yeah.
It's the mid-cheek fat part compartment and the middle part of the jawline.
Yeah.
So all areas actually, in the jawline, I have like the danger zone here because of the facialis vessels here. In the mid-cheek area, I can spread it easily. It's on the top of this mass area actually, where I'm placing here the hyaluronic acid. And in the tear trough area, it's fantastic to use the cannula, but you may entry 2 times actually to get a very round-shaped appearance and to place it exactly on the right position. The danger, in my opinion, if you're using the cannula in the tear trough is if you're not going deep enough, you will still place the hyaluronic acid on the top of the orbicularis muscle. And then you will cause even more swelling, you will cause more irregularities, more pumpy appearance afterwards, and it's actually very difficult to spread then. So always place it on the bone here, and with placing it on the bone, you will also have a lifting effect on the orbicularis muscle because the orbicularis muscle is enhanced, elevated because of the volume you're placing underneath it.
And concerning the lips, sometimes do you use the cannula?
Yes. When I have a very, very tiny lip structure actually, and also a patient that tends to bleed a lot and where I have to also dissect the lips fibers, so I'm getting a more round-shaped appearance, then I love to use the cannula. So it's actually not even easier for me, but it's getting a better result. But in the vertical technique, for sure, you're always using the sharp needle technique here. You also can work with the cannula on the border, but again, this is a little bit tricky. If you're not directly in the border, you may cause some migration by doing that.
Yes, absolutely. I think that the needle gives higher precision and definition of the result. Of course, we have more bleeding sometimes, and in a specific area, cannula is absolutely safer, and so perhaps it's better to use it. But I agree with you that with needle usually we have a very high defined final result. Okay, so now I'm asking if someone have some questions for Marcus before to close the connection with Vienna. I think that we are close to the dinner time, so everybody want to go to the dinner. Okay, Marcus, we have no answer, and we thanks a lot again for your injection, and congratulations for the fantastic result that you showed us, and I hope to see you next time here with us to inject here in Saudi Arabia.
Thank you. Thank you very much. Have a nice evening to Saudi Arabia. Thank you.
Okay, so I think that we can close. I give the podium for the closure, and I thanks a lot for your attention. Thank you.
Thank you, our esteemed guests, Dr. Salvatore Fondaro and Dr. Marcus Handel, for their insightful and captivating presentation and live demo. نشكركم ضيوفنا الأعزاء وزوارنا الأفاضل على وقتكم الثمين ومشاركتكم المميزة. نحن على ثقة من أن إيفوار سيمنحكم الحرية الإبداعية التي من شأنها أن ترتقي بممارساتكم التجميلية وتحقيق النمو والتميز الذين تتطلعون إليه. ندعوكم الآن إلى مشاركتنا في حفل العشاء في الصالة المجاورة إلى اليمين. نتشرف بحضوركم ونأمل أن تستمتعوا ببقية الأمسية. Dinner is now served. Thank you.